Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 347,466 confirmed cases of COVID-19 in Canada and 107,883 cases in Ontario. Chatham-Kent has 484 cases and Sarnia-Lambton has reported 404 cases. Michigan now has 324,779 cases, with 19,263 cases being in Detroit. Today we are reporting 33 new cases of COVID-19 in Windsor and Essex County. Of the 33 new cases, 14 are close contacts of confirmed cases. 4 are healthcare workers, 2 local and 2 from Michigan. 1 is travel related. 4 are community acquired, and 10 are still being investigated. We have had 3,456 cases since March. 3,042 cases are now resolved, and 336 cases are active and being followed by our health unit. 16 people are currently in the hospital, and 4 people are in ICU. Our community has now lost 78 people to COVID. 54 deaths have occurred among residents in long-term care and retirement homes. There are currently 5 long-term care and retirement homes experiencing a COVID outbreak. There are 5 workplaces in outbreak. 1 in a healthcare workplace, 1 in manufacturing, 2 in the agricultural sector, and 1 in a place of worship. 2 schools are currently in outbreak, and there are 2 community outbreaks as well. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit your number of contacts. Keep 2 meters distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering if you cannot maintain a 2-meter distance from others. Avoid touching your eyes, nose, and mouth with unwashed hands, and cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. Testing for COVID is available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 2 assessment centers, Windsor Regional Hospital, Olette Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for the further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. I have a short comment today, and this is related to the Americans' Thanksgiving and the Black Friday shoppings. The year 2020 for some really went by so quickly, and for some it took a long time. For us in public health, we can't even imagine that November is here. And while many Americans are celebrating Thanksgiving, we just realized that it's the time and we should have provided some messaging around that, but it's never too late. While it's time for joy, time to reunite with the family for those who are celebrating American Thanksgiving, we must not forget that we are still in the middle of the COVID pandemic. Just like we celebrated our Canadian Thanksgiving following the public health recommendations, it is still important to continue to follow these measures for the American Thanksgivings as well. What it means, if you are celebrating American Thanksgiving in Canada, please celebrate it only with the people you live with and find virtual ways to connect with your family. If you are planning to travel to USA, please remember the border is open only for essential travel. While it's possible that the border security forces on either side may let you cross, but it's really important that you stay only with the family that you live with. If for any reason someone is traveling to USA to celebrate American Thanksgiving, the entire family must quarantine upon their arrival back to Canada. If you are planning to enjoy football with your friends and family, please enjoy it virtually and connect with them via videos to share, laugh, and have a good time. If you're planning to do shopping, try and support local businesses by arranging pickup or home delivery instead of going to stores in large numbers. Please follow all the public health measures to keep yourself safe, keep your family safe, and keep your community safe. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Good morning, Doctor. Good morning, Teresa. Can you tell us more about this individual who's died of COVID-19?
I can tell you that he had been in the hospital and that we were made aware of him about a week ago, and that he is from the Windsor area. I'm not quite sure how old he is, though.
I noticed the number of deaths attributed to people in long-term care retirement homes didn't go up, so he was a member of the general community?
Yes, he lived in the community.
Okay, that's everything for now. Thank you.
Any questions from AM 800?
I'm just wondering if there's anything more you can say in terms of possibly changing statuses tomorrow or color-coded system.
Well, I think I spoke to about it yesterday, and as we continue to monitor our case rates, our effective reproduction rate of viral activity in the community, and the percent positivity that we are seeing in the community. Based on all those quantitative measures, we are technically in the red zone already, but also the time that it took us from orange up till today, it's just 3 days. So we are looking at some of the impacts of those actions as well. And so tomorrow, obviously, there may be some discussions with us and the ministry in terms of what does it mean, what additional qualitative data that we can provide to the ministry to help them understand the local situation, and any increased risk to the community. So we'll be having those conversations. And at this point, I can't say what the outcome would look like, but definitely an opportunity to put everything into perspective, the timeline, the additional measures, and the cases that we are seeing every day.
And in terms of outdoor community events, you're probably aware that in Amherstburg, there's now an amendment to the NOx bylaw saying that anyone who attends River Light outside also has to be wearing a mask. And I know there's another lighting event in downtown Windsor coming up. So I'm just wondering if you have a recommendation for anyone who is planning on going to any of these outdoor public events in the city or in the county.
So from our public health standpoint, we have always said that any activities that brings people together, they should be avoided at all. We recognize that there are some essential activities that people need to do, and they should continue to, or they can continue to do that in a safer manner. But especially when we are talking about a large group of people going into these places, we really have to look at what are the measures that are keeping them safe to ensure physical distancing, to meet the need, meet the requirement for the organized activity. I think if it's managed, how where these people are entering, where these people are exiting, what are the lanes, how people are moving. So there are a number of the recommendations that we have around that, but the general advice is always the same. We do not recommend any large gatherings, whether we're talking about indoors, definitely no. Even outdoors, we do not recommend to have these type of activities, just for the risk of more people coming in. There will be more opportunity for interaction. There will be more opportunity for people to come close to each other within their 2 meters distance, and it puts everyone at risk.
Hey, thank you.
Any questions from CBC?
Yes, good morning. Do you know what sort of community partners are supporting the Bakley families impacted by the outbreak right now?
So for the school, it's obviously we are working with our school board, and the hospital provided the testing facility or testing opportunity for all the families. More broadly, I'm not aware of any other agencies or any other departments who are supporting these families. We haven't heard a lot of any concerns, and I think we in our conversation with our school boards, we did ask these questions, and the ministry is also interested in asking this question, that what kind of hardships that these families may be going through when they are isolating, or if some of them are positives, what kind of support system that they need. We haven't recognized any specific concerns at this point, but obviously we are aware of it, and we are trying to stay on top of it. Any of those concerns and issues, depending on what, from the health perspective, from our community partnership perspective, we will continue to provide.
Okay, and we've heard from businesses locally that say that the changes that are happening each week as we're moving into different provincial categories are harming them, and that they're a little bit confusing to customers. Do you think that maybe the province should be not assessing the data weekly, so they should allow us to maybe stay in a category a little bit longer than a week before making that call?
So as I was answering to Christy Lee, those are some of the discussion that we definitely would like to have with the province, to see the impact of some measures that we identified a couple of weeks ago from us when I issued that letter of instructions to the businesses. It takes time to see the result from these actions, and as we know, the incubation period could be up to 14 days. So whatever we are seeing today could be the result of what happened last week or even the week before. So I think there is that delay, and we have to be mindful of that. But again, some of these decisions are with the province, and we do provide our input. We do provide our qualitative understanding of the data as well, on top of the quantitative assessment. But we also know from the evidence perspective is, if we wait too long, sometimes it takes the disease or COVID spreads much more in the community if we wait for too long. So I think it's it's the fine balance that we have to do, and make sure that we're not putting anyone at risk, and we're not putting any unnecessary pressure to our local businesses. We do support our local businesses, and that's why all this conversation, all this support, all this education that we are doing is in the effort to provide a safe environment everywhere, at the businesses, at the retail stores, everywhere. And we need support from our community. We need support from our businesses to keep it safe and keep it that way. And a lot of that, it goes back to, again, everyone and all of us is responsibility. But at the end of the day, there are these recommendations and these guidelines that comes from the province, and we just have to follow it.
And then just one final question here. The Auditor General's report yesterday was critical of the province's COVID-19 response. What did you think of this in the report that came out?
Well, I think I'm sure that there may be more opportunities for the province and for other agencies to look at the overall pandemic response, the public health capacity, the response from public health and from others too. Obviously, my field is public health, so I'll stick to public health. There has been a number of changes that were anticipated when we entered into the pandemic. There was this talk about modernization. There was talk about consultation that was ongoing. And we were also supposed to have that consultation with the ministry on the public health modernization piece. So there were a lot of ambiguity, uncertainty was at play when we entered into the pandemic. And again, recognizing that many of these challenges have been there for a number of years. And in the pandemic, it was exposed. I'm sure that there's a lot of learning that would happen, and there's a lot of, I guess, references to some of our unique challenges in that report too, especially in Windsor-Essex. So I think we will be looking at it. We will be learning from it locally, internally. We always do, but we hope that the report will trigger further discussion on the key issues that is addressing public health more broadly.
Okay, thank you.
Any questions from Blackburn?
Just one small clarification. Teresa, you mentioned that you heard about the individual who passed away last week. He was in the hospital last week, or he died last week?
Oh, sorry. He passed away yesterday, but we were aware of this individual being in the hospital previous to that, so last week.
Okay, just want to clarify. Thank you. That's all. Thanks.
Any further questions from the Windsor Star?
Yes, and again about the man who passed away. Could you give us his age range?
I just looked it up, and he is in his 60s.
And are you able to tell us if he had any underlying medical conditions?
Yes, I can confirm that as well.
Okay, and then separately about the new workplace in Lakeshore experiencing an outbreak, what is a healthcare and social assistance workplace? Can you be a little more specific about what kind of business that is?
I don't know. We have our meetings every day, and we go through all of our lists, and this was brought forward yesterday that there was discussion, so I'm not completely sure. I saw that as well, so I'll get more information today, exactly what that is. But we're trying to categorize it, and that was one of the categories.
Okay, thank you.
Any further questions from AM 800?
Yes, sorry, another question on the person who has died. I think the number of people who are in the ICU has gone down now. So was that a person who was in the ICU?
I can't confirm that, but he had been in the hospital, so
Okay.
yeah, I don't know.
Okay, thank you.
Any further questions from CBC?
I'm good. Thank you.
Blackburn?
I'm good. Thanks.
Thank you, everyone.